Hi, I'm Tomi Hiers, Vice President of the Center for Civic Sites and Community Change at the Amy E. Casey Foundation. I lead a team that works in several places around the country, including our two hometowns of Baltimore and Atlanta. What really grounds our work is the simple belief that if we want young people to thrive, then the communities where they live should be strong. And strong communities are possible when young people have the support they need to succeed in school and life, when people can access training and good-paying jobs, and when families have stable housing and they feel safe. The Annie E. Casey Foundation invests in place-based work because improving outcomes for kids and families requires changing the systems and conditions that shape their daily lives. And those systems can be inherently local, meaning community-based. Outcomes for young people are deeply influenced by where they live. And by focusing on specific places, Casey can address the interconnected barriers that affect families in a coordinated way, rather than tackling issues in isolation. Housing matters to the Casey Foundation's mission because it's a foundational condition that shapes whether children and young people can access the opportunities and supports they need to thrive. Housing shapes access to opportunity. The neighborhood in which a family lives determines proximity to quality schools, safe environments, job opportunities, transportation, and community resources. Without access to stable housing in opportunity-rich communities, children face compounded barriers that affect their long-term outcomes. Housing instability is closely tied to educational success. When children move frequently or experience homelessness, they are more likely to miss school, fall behind academically, and experience social and emotional stress. Frequent school changes can interrupt learning continuity and weaken relationships with teachers and peers. Stable, affordable housing allows children to remain in the same school, build supportive relationships, and fully engage in their education. Housing is also a critical driver of economic stability for families. When housing costs are too high, families are forced to make difficult trade-offs, often cutting back on essentials like food, transportation, and childcare. High housing cost burdens can also limit parents' ability to pursue stable employment or job training. Affordable housing frees up resources and creates the stability families need to maintain employment, to build savings, and to invest in their children's futures. For these reasons, housing is not just one of many issues. It's a platform that underpins everything from education to economic well-being to health. Advancing Casey's mission to improve outcomes for children and families requires that ensuring that all families have access to safe, stable, and affordable housing that connects them to the opportunities they need to succeed. The Pittsburgh Homes Project highlighted the unique and multifaceted role that the Annie E. Casey Foundation or any national foundation can play in neighborhood redevelopment, one that goes well beyond traditional philanthropy. It underscored how Casey acted as a long-term partner, a systems builder, and a catalyst for equitable development by leveraging patient capital, convening power, policy influence, and a commitment to elevating community voice. First, patient capital was really important. Neighborhood redevelopment, particularly in historically disinvested communities, it requires sustained investment over many years. Casey's ability to provide flexible, long-term funding allowed the work to move at a pace required for meaningful change rather than being constrained by short grant cycles or immediate returns. Second, the initiative illustrated Casey's convening power. Redevelopment efforts often involve a wide range of stakeholders, including residents, developers, financial institutions, and public agencies. Casey was able to bring these actors together, align them around a shared vision, and facilitate coordination across sectors that don't typically work together. Our ability to serve as a neutral and trusted convener helped reduce fragmentation, build partnerships, and maintain momentum over time. Third, the project highlighted Casey's ability to exercise policy influence. Beyond investing in specific projects, Casey helped shape the broader policy environment that governs housing and redevelopment. That included engaging with local government, informing public investment strategies, and advocating for policies that support equitable development and also prevented displacement. Finally, the Pittsburgh Homes Project emphasized the importance of elevating community voice. Casey supported processes that centered residents in decision-making, ensuring that the redevelopment reflected the priorities, needs, and aspirations of the people who actually live in those neighborhoods. Taken together, these elements reveal our long-term role of place-based partnerships that not only invest in resources, but also builds alignment, shapes systems, and centers community leadership. And these are roles that other national foundations can play to help shape neighborhood redevelopment. The Pittsburgh Homes work helps clarify how the Casey Foundation is approaching the next chapter in its housing and community change work, not by continuing to directly invest in large-scale redevelopment projects, but by applying and sharing lessons learned to drive broader systems-level impact. First, the work points to the importance of scaling policy. Through the place-based investments, we saw that even well-designed community-centered redevelopment efforts remain limited if they're not supported by durable public policies and funding streams. As a result, our next chapter is focused on translating the on-the-ground lessons into policy change that can reach far more communities. Second, the experience reinforces a strategic role for impact investing. The Pittsburgh Homes Initiative demonstrated how flexible patient capital can unlock redevelopment in ways that traditional financing often cannot. Third, the work highlights the need for stronger systems alignment. One of the clearest lessons is that housing outcomes are shaped by multiple interconnected systems, including housing, but also workforce, education, health, and human services. In our next phase, we're focusing on aligning these systems so that investments in housing are coordinated with the supports that help families achieve stability and mobility. Importantly, this chapter reflects a shift in Casey's role. The foundation is no longer pursuing this type of direct place-based redevelopment investment at the same scale. Instead, we're stepping back to synthesize and share lessons learned, influence policy and capital systems, and support partners in applying these insights in their own contexts and shape the conditions that enable housing and community change nationwide. Casey has always approached housing as a means to improve outcomes for children and families, not just as an end in itself. It's not just about simply preserving or building housing units, but ensuring that housing connects families to opportunity, the good schools, stable employment, healthcare, and services. This work has consistently emphasized preventing displacement. In many communities, redevelopment could lead to rising costs that push out long-term residents. We've been very intentional about supporting strategies that allow existing residents, particularly low-income families and communities of color, to benefit from neighborhood improvements rather than be excluded from them. Our housing efforts have highlighted the importance of community ownership and leadership. Whether through engagement processes, partnerships with local organizations, or support for resident voice, the foundation has prioritized ensuring that redevelopment reflects community priorities, not just physical assets. And finally, the work has shown that housing cannot be solved in isolation. Effective strategies require coordination across sectors, including workforce development, education, human services. This reinforces why Casey is increasingly focused on system alignment and policy change rather than a standalone set of housing investments.